All right. Now,
Yeah.
we mentioned Parkinson's, and we dealt with diabetes, and what about muscular sort of sclerosis?
Yeah, MS.
MS, right?
Yes. Again, that's a condition.
Multiple.
Multiple sclerosis.
Right,
Okay,
okay.
MS. We're dealing with conditions where you have the spine and you have the central nervous system. We have a coating, and it's called a sheath. And think of a cord, a power cord. You plug the power cord into the wall, and you have wires. Within the wires, we have a rubber or a plastic, a vinyl coating over it so you don't get shocked. But that also, it's an insulator. We have the same thing within the spine. We have an insulation. It's called a myelin sheath. Well, what happens is the myelin sheath starts to deteriorate. Why do we get this? Unknown. Is it genetics, or is it due to medicine, or is it environmental influences? Is it generational? We're still trying to work that out. We're not able to pinpoint it, but we know there's something's going on, and it causes a deterioration of that myelin sheath. When you lose the insulation, the nerve signal, the conduction decreases, and it gets to a point where the nerve conduction stops because the myelin sheath, what we call the gap in between, increases, and the signal's not able to move forward and tell the body what to do.
This is when you're getting up in the morning and you got the terrible back pains.
Well, no,
right.
it's more, you're going to start to seeing the spasms and the cramp and uncontrollable, you're not able to control your muscles because the signal's not there. It's on, it's off, it's on, it's off. So what I can do is I treat the pain that's associated with it as well as the muscle spasms. Some of the studies suggest that we can slow the progression of the disease.
So this is more muscular.
Muscular.
Because I noticed in the book it also speaks about severe back pain.
Yes.
And I'd like to get into that, and where you don't want surgery. Okay?
Right. Well, I have most of my patients now are suffering from chronic pain. It could be due to cancer. I have a lot of patients because with associated cancer. They have post-surgical pain because they cut through nerves. You have nerve damage. Then when I have cervical and lumbar disc pathology, where they have a disc bulge or a disc herniation and it's impinging a nerve. Some of them had surgery to correct it, and they still suffer from pain. So I can treat that with medical cannabis. So to have an understanding of how we treat. In New York State, we do not have the bud itself, the flower, or some people a joint. We have the plant itself, and we grind down and extract out oil from the plant, and then we have 3 different ratios because there's 2 chemicals that we use. They're called cannabinoids, and we have 2 chemicals. And in the book, I explain this. It educates you. I wrote this book that the reader, a layperson, can understand. It's a textbook with no scientific Latin terms, no biochemistry. I break it down that the average person can understand this book, and they can see the sequence of.
It's amazing, this book.
Well, I want the reader to understand my thought process and how I make decisions, as well as what the patient was suffering, and you're walking the path with them as their initial office visit to the end of their treatment to where they are with me today. So you can see this. Now, getting back to the pain, I will choose a specific ratio based on the type of pain, because you have different receptors, different pathways going up to the brain or just going into the spine and back out. So I have to choose a different ratio based on the individual's needs. New York State offers what we call delivery systems, and I explain that in the book. Every year, the New York State allows to increase the type of delivery system. But we have vapor, that's like smoking an e-pen, where you see everyone that's smoking electronic pen. Like for cigarettes, the nicotine, we have the same thing, but in the tank it has the oil. Then we have oral. It could be either a capsule or a pill, or it could be a sublingual drop, what we call a tincture. And each have benefits. Some there's I'm not too big on a capsule because the expense it's a little bit more expensive, and then the onset of action is longer. That takes about an hour and a half to kick in. So if you're suffering from pain, you need relief now. If you
Right.
take a capsule or a pill, it takes about an hour and a half before you feel the effects. It has to be digested, broken down, absorbed. It has to be processed by the liver, and the liver will release the metabolites. And once it hits the bloodstream, those chemicals will look for those receptors and then to decrease the pain. So if you're suffering from pain, that's not my first choice. If you need quick onset, I advise going with the vapor. Onset of action is only 90 seconds. 90 seconds and you're feeling the effect. If you need quick relief but not that quick, then or they don't feel comfortable using a vapor, then I say try the tincture. You put it underneath the tongue, hold it in so we can bypass the liver. Onset of action is about 20 minutes, give or take 10 minutes. I've had patients claim that they felt the effects in about 10 minutes, but typically 20 minutes.
Right.
So depending on the individual's needs, I will cater and tailor my treatment for their condition.